Hi, this is Stacy Hammond with BioNV Hormonal Wellness and Early and Dr. Stephanie McCain's office in Abilene, Texas. And I'm here to talk to the men today about a new remarkable procedure that we're offering in our office called the Priapus shot or P shot. Now, we treat a lot of men in our clinic for hormone imbalance, and oftentimes what we find is that with low testosterone, men will suffer from a lot of issues such as muscle loss, fatigue, insomnia, and also erectile dysfunction issues. And with correction and optimization of hormones, many of those erectile function issues are restored. However, it still may be a problem for some people despite optimized hormones. So men that have had other issues such as diabetes, hypertension, perhaps they're on medications for their hypertension that affect erectile function. Sometimes after strokes, there may be some men that cannot do hormone optimization because of prostate cancer. We have some men that have had prostatectomies that have difficulty with erectile function. So we want to talk about this new procedure, and what the P shot or the Priapus shot is where we use, it's called PRP or platelet-rich plasma. We actually use the patient's own blood. We draw the blood, we take it, and then we spin it down in a special machine called a centrifuge. And that's where we are able to separate red blood cells. And then we take off the rich components of the blood that have a lot to do with healing and tissue regeneration. At this point, I'll remind you, when you were a kid, you probably remember falling on your bicycle, skinning your knee, and then in a few days, you saw the new skin growth on that area of the knee, which created new healing, a new scab, and then the tissue looked almost brand new again. So the same concept is true. When we draw this platelet-rich plasma, we're able to re-inject it back into direct areas. PRP's been used for years in orthopedics. We use it in cosmetics. We use it in women in a procedure called O-shot. But for men specifically, this PRP can be re-injected back into the penis. And what it can do is help with sensitivity. It can help with erectile function. It can help erections much stronger, last longer. It can help even with growth in the forms of girth and length. And so it does a lot to just help restore those relations, you know, for that man who may be struggling and maybe hormone optimization is not completely restoring those functions. Now, there's several types of men that we deal with. Some are young and may say, I don't have problems with erectile function. My, sexual life is good. Maybe those guys just want to make it better or great. And then there are the men that are affected with other comorbid factors like diabetes, hypertension, maybe stroke, prostate cancers, things of that nature that really struggle. Maybe they've used different kinds of medications, Viagra, Cialis, Levitra. Those work for some people, but not for all people. And some men can't take those because of the side effects of the medication. So this is a great alternative to that, or even to be used in conjunction. The procedure is a relatively easy procedure. It's done in about 20 minutes. It's relatively pain-free, believe it or not. So when the gentleman comes in, we use numbing cream to topically numb everything, and then there's some local injections. We use a very tiny needle to place the PRP into certain areas that help restore these issues that we talked about. And again, what PRP does is it brings in new stem cells and healing factors that cause revascularization. So it actually restores and regenerates that area. Again, very easy procedure called the Priapus shot or P shot, now offered in our office in BioNV in Early, Texas, or at Dr. Stephanie McCain's office in Abilene. So if you have questions, we encourage you to research this, give our office a call, and we love to give you more information about it. Thank you so much. Have a great day.